And Kibitsky. I'm a trustee in Riverside Township in Cook County. I'm here to introduce Jennifer Walsh Hammer. If you are here for the Affordable Care Act requirements for townships, you're in the right place. Otherwise, you'll have to find your right place. Okay. Jennifer Walsh Hammer is with the law firm of Giffen, Winning, Cohen, and Bo Davies, PC, practicing in the areas of municipal and local government law, commercial litigation, and lobbying. She represents governmental units such as villages, townships, and counties in many matters, including ordinance enforcement and prosecution, contract drafting and negotiations, election law, and labor and employment issues. Jennifer trains governmental units and trade associations on the Freedom of Information Act, Affordable Care Act, Open Meetings Act, Gift Ban Act, Illinois Governmental Ethics Act, and the Illinois Election Code. Ms. Hammer is licensed to practice law in the state of Illinois. She received her undergraduate degree in Justice Studies from Arizona State University, her law degree from Southern Illinois University, where she served as editor on the Southern Illinois University Law Journal and received the award of Best Editor. She currently serves as a governor for the Illinois State Bar Association and is a past president of the Central Illinois Women's Bar Association. Please join me in welcoming Jennifer Hammer.
Thank you. Okay, good afternoon. Can you guys all hear me in the back there? I'm kind of double mic'd here, so hopefully you can still hear me. Okay, what I'm going to do is basically go through, you heard all about me. What I do is train governmental units and try to get them prepared with old legislation, new legislation, but helping you be in compliance with a plethora of different legislative areas. So today we're going to talk about the Affordable Care Act, and hopefully I can answer some of your questions. Really, townships, we'll look at it from an employer perspective, but really I'm going to give you an overview of what you need to know about the Affordable Care Act and just some general frequently asked questions. Hopefully I'll give you some answers to some of those things you've been wondering. So I'll flip through the slides. Whenever you have a question, feel free to raise your hand. I'm happy to kind of stop and address questions as you guys have them. I find that it's easier to address a question when you're on that subject matter rather than trying to come back to it. I will say that I'm not going to entertain any sort of political arguments. I'm not here to be a proponent or an opponent of the Affordable Care Act or Obamacare, whatever you want to call it. I'm here to tell you what it is, how it's going to work in your township, and how you can implement it and use it in your everyday life. I will go into some details about how you as a consumer or a patient will be affected as well so that you have a general idea of that. But hopefully you walk out of here knowing 10, 20 new things and understand it a little bit better and how it's going to impact your life. So without further ado, you should have handouts. I kind of did the one-page layout this time so you have room to jot any questions you have. My contact information is on the front, and I'm happy to answer questions if you think of them later. So don't feel bad about giving me a ring or shooting me an email. So, okay. So what is the Affordable Care Act? March 23rd of 2010, Obama Care, or the Affordable Care Act, was enacted. And with everything that kind of gets through any level of government, there are some good policies in here and some things that seem like they may not be so good. So I kind of laid those out so that you would have an understanding of the idea that this is supposed to be something that provides more efficient and cost-effective health care in comparison to what our current system is. So some of the positives are that insurance companies can no longer deny care because of pre-existing conditions. This is a good policy. This helps out those individuals that have a pre-existing condition that really could not get coverage before. They were just denied from, every single insurance carrier. Insurance companies can no longer manipulate insurance premiums to make the cost of a policy unaffordable. Consumers or patients, I'll use consumers throughout this, really think of it as yourself as an individual or a patient. Consumers will not lose their health care coverage when they lose their job. They will not lose their policies when they get sick. Adult children will now and are now able to stay on their parents' policies through the age of 26. And we'll talk about a little bit later the age gap of where people are uninsured and why it was necessary to put those people up to age 26 in insurance plans. The lifetime dollar limits on payments by insurance companies is no longer allowed. And the max out-of-pocket copay limit for individuals is $63.50 annually and $12,700 for a family, and that's the 2014 number. So although people kind of read this and hear on the news that, oh my gosh, it's going to be completely affordable, some of you are probably thinking to yourself, $12,700 for a family out of pocket is a lot of money. And it is. It is a lot of money. So, yes, sir. Wow, in the intro.
Well, it's something that I'm finding out that you have listed as a positive that's going to be a negative for my employees.
What's that, sir?
And that's the elimination of the lifetime cap. I have seen a model of what Blue Cross and Blue Shield is going to do to be in compliance with that, and what they've done. The insurance policy that my employees currently have is no longer going to be available, and the one that they will have to go to will raise their potential out-of-pocket expenses from $500 to $4,000 in order to be in compliance with that provision. So, in my pea brain, I thought they would simply adjust the rate, but they're not adjusting the rates. As a matter of fact, the rate's going to wind up being a little bit less for me, but it's going to negatively impact the amount of expenses. And that's for everybody in the state of Illinois that has Blue Cross Blue Shield. So most of the policies that they have now, the way they're structured, are going to be altered, and there'll be a great deal more of out-of-pocket to account for this. And I always had a way of dealing with this if one of my employees had a lifetime cap. If you simply changed insurance company, if somebody got to that threshold, you would reset that bar. So I can't know. So I now have to figure out how to deal with all this additional expense that my employers are going to have as a result of the changes in their structure of their policies.
Sure, and I do understand that, and I'll give you some quotes in a few minutes here about the out-of-pocket and things like that, and that it is difficult. I have one question for the others in this room. Are you guys able to hear when other people in the room speak? Okay, otherwise I was going to walk the mic around. Yes, ma'am.
It says consumers will not lose their health care when they lose their job. Who picks them up? Will they just get another carrier?
Right. Or also COBRA, which they had previously, and there's been some changes to COBRA, and the COBRA notice changed a little bit. So these are kind of the general overview of what it was supposed to do. Okay? So, and the general feeling that these are the positives that, hopefully will come. They're working out kinks still. Preventative. Okay, so the max out-of-pocket, we talked about that, max out-of-pocket that is supposed to be affordable to some people will feel really unaffordable. And so I don't know if people had an idea of the dollar amounts on some of these things. And I'll talk numbers quite frequently today so that you guys have a real grasp on what's going on. Preventative service costs is going to decrease. If you've gone to your physician lately for preventative women for their annual, or you'll notice that you don't have to pay anything. And so preventative service costs have substantially decreased, if not been eliminated in most cases. So that's a good thing, because we all know that preventative care hopefully prevents a situation from occurring, an illness from occurring, rather than reacting to an illness that has already occurred that would be substantially more costly for not only the insurance companies but also the individual, and causes increased likelihood of other illnesses down the line. So the preventative service cost decrease seems like it's going to be a good thing. There's also going to be an opportunity for internal appeals and external review process for any denied claims. So you have a real way to say, hey, this is denied and it shouldn't have been denied. So there's not only going to be that internal appeals process, but also an external review process. So some of the potential negatives, and I'll tell you that I had an opportunity to briefly chat with the president of the Illinois State Medical Society on their thoughts. And of course their thoughts are, not every doctor thinks the same, and not every lawyer thinks the same. So you know that it's kind of hard for them to represent one way or another. But this was something that he felt was true, that there are going to be, and there are studies that support this, but there are going to be physician shortages. The areas of practice are going to be internal medicine, family practice, and pediatrics. Simply the fact that, people get out of residency, there's not as many residency programs, and there's not the huge cost benefit at the end, salary-wise, for these practice areas. And so they're not seeing as many people going into these practice areas. They estimate that there's going to be about 90,000 the amount's going to be 90,000 physician shortage by 2020 and 130,000 by 2025, which obviously common sense tells you that means you're going to wait longer at your doctor, as if you don't wait long enough. So what's the result of that? More services are provided by mid-level providers, which I kind of put under the negative area here, because the mid-level providers, although they provide a really good service, they just simply are not educated to the level of your physician. And so you're not getting the level of service that you would have otherwise gotten. We all know that we have the best healthcare system in the world here in the United States, and I don't think anybody could in their right mind get up here and tell you to move somewhere else and go get health care. But just know that some of these things are going to be changing as a result of this. So those are some of my negatives that I just wanted to throw in there. Now, June 22nd, 2010 was the Patient's Bill of Rights. This was a set of regulations that applied to the health care coverage. And I just wanted to give you a brief quote here. It says that these are to help children and eventually all Americans with pre-existing conditions gain coverage, keep it, protect all Americans' choice of doctors, and end lifetime limits on the care consumers may receive. These new protections create an important foundation of patients' rights in the private health insurance market that puts Americans in charge of their own health. So that was the initiative right off the CMS.gov website for the federal government. So, and then June 28th, so we were kind of in limbo for a couple years, from March until June, wondering, okay, is this really going to be something that we're going to have to deal with? And on June 28, 2012, the United States Supreme Court said the Affordable Care Act is constitutional. So it is something that is going to affect all of us, and we'll talk here in a second about. They didn't say all of it was. They kind of rolled back a little bit on some Medicaid stuff. But so let's talk about how this affects Illinois. So the numbers in Illinois before the Affordable Care Act, 52% of your population was in small or large employer-sponsored plans. 32% were in Medicaid or Medicare, some sort of state assistance type of program. 4% were in individual plans, and 12% were uninsured. Of those 12% that were uninsured, 24% of those were between the ages of 18 and 25 years old. So you can see why, that short 7-year gap has 24% of the uninsured in it, why it would make sense to put those in the stay on your parent plan group there. Okay, so then what does this mean for Illinois? Affordable Care Act provide the options for states to develop their own exchange or marketplace or rely on the federal exchange. We can talk a little bit about what the exchange is. Essentially, people have said it's kind of like the Expedia of healthcare. You go to it, you put in some brief information, and it pops out with these numbers and all these options of plans that you can purchase. So Illinois decided on July 14, 2011, Quinn signed into law Public Act 97-142, and this was the Illinois Health Benefits Exchange Law. It was effective immediately, and what it did was it attempted to allow Illinois to set up their own exchange for individuals and small businesses with 50 or fewer employees to get on there and get health insurance. It also established a 12-member legislative study committee, which produced a report October 18th of 2011, a final report which is available online. But it also said, that Public Act said that it desired to preserve flexibility in the health insurance field along with avoiding undue federal regulations. So there was a clear understanding here in Illinois that our legislature wanted to kind of have a handle on what was going on and set up their own exchange. Unfortunately, that did not get done. So what we have now for this first year is a hybrid model. It's called Get Covered Illinois. It's basically a landing page at this point. And for the first year, the federal government said, okay, we can do a partnership where the state will run the plan management and the in-person consumer assistant part of it, and the federal government does the rest. And then the second year, it's a state-based marketplace. So for a year here, we're getting a little bit of assistance from the federal government. We basically have a landing page where it directs you, you put in some brief information, and then it directs you somewhere else. We don't have a full exchange here in Illinois quite yet. So then the federal exchange is the healthcare.gov. Basically, a consumer or patient goes on there, puts in that information, and can select their own insurance plan and determine whether they are eligible for a tax credit. The consumer is not able to look at the physician network, which is one of the things that I put in the negative category if we're going to talk about positive and negatives. They have to actually, at this point, go to the individual insurance company and look at their website to determine what the network is. So this could provide some real problems with people that are trying to compare apples to apples, as it's been put, and you're trying to compare apples to apples, except that the networks aren't the same. So, for instance, you don't know if your physician is going to be in this Blue Cross offered health plan, or whether it's going to be in the Health Alliance. You have to go off of the healthcare.gov website onto the individual insurance carrier's website and try to find whether your physician would be in there. So that's kind of just a pointer to you guys. If you are shopping on here, make sure you go to their websites and make sure your physicians that your primary care physicians and the ones you care about are in network. Yes, sir.
Have people actually been able to get on the website? Because I'm hearing in all the news coverages that they're having a lot of trouble. Because I didn't have to, but just wondering if people are having trouble getting onto the website at all.
Um,
Sign up for coverage.
I tried and was unable. I've tried several times and was unable. I talked a few days ago to some people, and one of the ladies was able. She wasn't able to sign up, but she could at least see the numbers. You are able to go, like Blue Cross Blue Shield, I'm able to go on their individual website and simply put in my zip code, my dates of birth for my children or husband or whatever, and I am able to get quotes on there, but not in the exchange format where you can see all the different providers on one. So no, and they're working on it. They obviously know it's a problem.
Is
So
there a way that I can go out there and find what the prices are before I give them all my information, where they have access to all my information now? Everybody has access to my information. Can I get what the pricing is? Just if I say, hey, I want a plan, I want the I guess they're calling it gold and the
Sure,
platinum,
yep.
the silver. I want the gold plan. Can I get the pricing for that through my age without giving them, without putting in my information initially?
right, so I'll tell you what, actually here in a couple seconds, I'll tell you what my prices were, because I put my own information in there to kind of compare to what I have now and what was going on. All I had to put in there was my first name, my email address to start, then they let you in. My first name, my date of birth, and whether I smoked. Husband's first name, date of birth, and whether he smoked. And then my kids, I have 2 children. I just had to put their date of birth. And, you have to put your sex too. That's it. So.
Do you have to do that if I just wanted single coverage?
If you just wanted what?
I just wanted single coverage, like my wife.
No, if you just want individual coverage, no, you would just put yourself. Every time I wanted to add someone, I basically put add a person, and then, or add a dependent, and then what they were, male, female, and then their age. So it did make me provide my husband's name, which I thought was weird because I felt like they could trace it back or something, but I didn't care. So anyways, okay. So yes, and that was on the Blue Cross website, BCBSIL. So, okay. So the healthcare.gov is the federally supported exchange, and they are having some website difficulties, and it's been difficult. The last thing I heard was something like they were accepting 11,000 applications every 6 seconds or something. So somebody's getting through at some point, it sounds like, but I haven't been able to get through. So I'm not really sure if it is up and running exactly. Plans also may not cover out-of-network care. They also may not count those out-of-network expenses towards an annual deductible. So those are just pointers from me to you to make sure you compare and understand whether they're going to cover out-of-network care, or when we talked about that huge $12,700 out-of-pocket cost, whether your out-of-network care is going to apply towards that, because obviously you would want it to apply towards that. So those are some things to watch for. The numbers of consumers that have signed up here in Illinois, I won't have until mid-November. They're still kind of trying to generate those numbers, so that's why I don't really have an example this time. So I do have two examples. I will tell you that one is myself, and I went on Blue Cross Blue Shield because I couldn't get into healthcare.gov. And my coverage for 4 people ranged anywhere from about $600, $605, all the way up to $1,000. The $600 was with 6,000. It was with those maxes, 6,000 out of pocket individually, or 12,700 for my family, but 100% coverage after that. And then the higher premium was 1,500 out of pocket and 3,000, 3,100 out of pocket for my family, but only 80% coverage after that, which makes you a little bit nervous if you have something catastrophic and you have to pay 20% after that. I will tell you that that is cheaper than is what is offered at my employer right now. So I can't tell you whether it's going to be a good thing or bad thing for you. So on the flip side, my brother, who is a couple years younger than me, works full-time, works like 100 hours a week, but has his wife is in school and stays at home. They have 1 child. He always has had, he's in that small percentage that gets his individual coverage, not through his employer. They don't offer a plan. He gets it by himself, his family together as a plan in the individual marketplace. And his coverage is going up for the same exact coverage from $350 a month. The quotes are between $800 and $1,000 a month. So somewhat similar to my quotes of about $1,000 for a family. But his right now are $350. So his are going up substantially. Mine are going down a little bit. So it's kind of all over the place. So just so you have an idea of what those numbers are. Yes, ma'am.
Could you just give some clarification on the employer, and is it 50 full-time employees or 50 employees?
We're going to go through how you count it. We have a whole calculation on how you're going to count it.
And
So,
already on the lost job, are you talking
Oh,
COBRA? Has
I'm
it been expanded beyond the 18 months if you lose your job?
no. It was just a new notice requirement in some things. So, okay, timeline of changes. Prior to 2013, healthcare coverage was extended, like we talked about, to dependents up to 26 years of age. Preventative care coverage without cost sharing, and then the medical loss ratio, something insurance companies have to worry about. 80 to 85% of their premiums have to cover clinical services and quality. 2013 to 2014, large employers, so as she mentioned here, 50 employees or above, full-time equivalent employees, which I will show you how to calculate that. Large employers are required to provide affordable health care, keyword there, affordable health care. Medicaid eligibility and coverage is expanded. Coverage for children with pre-existing conditions, lifetime annual benefits limits are eliminated. Additional coverage of essential health benefits and preventative services. Low-income individuals to receive premium and cost-sharing subsidies. Introduction of the health insurance marketplace, which we've been talking about here, happened this year. And then individuals are required to have coverage and protection against premium increases. So in the future, what's going to happen, there's going to be an escalation of all the penalties we're going to talk about here on the very next slide. There's going to be increased federal match for CHIP, which is the Children's Health Insurance Program, from 23% up to 100%. States are permitted to form or join healthcare choice compacts. Excise tax is implemented against insurers for high-cost employer-sponsored insurance plans. So they cannot exceed $10,200 annually for individuals and $27,500 annually for families. And then I was just wanted to mention one thing quickly. We already, if you're paying income taxes, pay a tax on Medicare through your income taxes. And now there's going to be an additional 3.8% tax on investment income, and that's for couples making $250,000 or individuals making $200,000, including your investments in real estate. Okay, so I'm not up here trying to give tax advice at all. So my kind of disclaimer is that you should see your tax advisor, because I have a tax advisor as well. But you should see a tax advisor and ask them about this, but just be aware that there is an additional 3.8% tax there. Okay, let's look at the next slide and we'll talk about the penalties, because this is really what everybody cares about. So trying to decide whether you are going to have penalties. You'll see that my first question here is whether you have 50 full-time equivalent employees, and I will show you on the next slide, or 2 slides later, how to calculate that. If you don't have 50 full-time employees or full-time equivalent employees, which some of your part-time employees count towards this number, then you can just come on over here to the yellow determination here that says no penalty. Okay. However, I wanted you to be aware that if you have 25 or fewer employees and the average wage is less than $50,000, which I'm also going to show you how to calculate the average wage, then you may be eligible for health insurance tax credits, anywhere from 35 to 50%, sometimes 100%. So if you're in that really small category there, you may be eligible for some tax credits. Okay. If you do have 50 employees, then you're going to come down. So if you don't, you're just right over here. You're done. Your determination's done. If you do, you're going to come down here and do you offer coverage to your employees? No. Then did one of your employees go to this healthcare exchange that we've been talking about and receive a premium tax credit or cost sharing subsidy? And if they did, then you have to pay a penalty for not offering the coverage, which is going to be $2,000 annually. Now let's make it really difficult. Multiply by the amount of employees that you have minus 30, okay? So, and this is going to be actually increased annually based on some insurance premium numbers. But so the important thing is to remember that however many employees you have, subtract 30 out, 30 of your employees from that number. So if you have 120 employees, subtract 30, or 90 employees times 2, $180,000, okay? Okay. So this is if you don't offer any coverage, okay? If you don't offer any coverage, but none of your employees went to the exchange and got insurance, you can see my long line here. You're not going to be penalized, okay? All right. If you do offer coverage, then does the insurance pay at least 60% of the covered expenses for a typical population? If it doesn't cover at least 60% of the expenses, then your employees may choose to buy their other coverage in the exchange and receive a tax credit, and you have to pay a penalty over here for not offering affordable coverage. So not only do you have to offer coverage, we talked about on the previous slide, you have to offer affordable coverage. And so if it's not affordable, you're over here and you have to pay a penalty of $3,000 annually for all your full-time employees. Okay? Which receive the tax credit. The maximum penalty is 2,000 times the amount of employees over 30, okay? So there's a cap on it from the previous penalty slide up there. There's a cap on it, but still. Okay, so then if it is affordable, you come down here and ask, does the employee's portion of the self-only premium, when I say self-only, I really want to emphasize self-only, the individual's premium. Not the family, just that individual. Whether that premium exceeds 9.5% of the household income.
How would we know about the household income?
Maybe you should ask. I mean, I'm not really sure. I've been kind of telling my people to just base it on what they make from you.
I mean, I would think that
Yeah.
you would only.
So, yeah.
But you said household.
Yes, and that's what they provide, yeah. So, but I've been advising my clients to base it on what you are paying them. Okay, so 9.5% of their wages from you. Obviously, that number is going to be lower than the household income because no one can make a negative amount, right? Okay, well, some of us, well, okay. Okay, so then if it exceeds 9.5%, you're going to come to the right here. And these employees can choose to buy their coverage elsewhere and then receive a tax credit, okay? Notice again that it does not say family plans. So these family plans through employers can be outrageously expensive, $500-700 a person, a dependent, and that's allowed. Okay. I also want to make a note here about the 9.5%. This is still being discussed, but there's control groups. So when I talked to a lady that her entire profession is human resources. That's what she does. And her interpretation of this was that there are control groups. So all of your hourly full-time employees are in a control group. All your salaried full-time, all your part-time, and all your part-time salaried and part-time hourly. So there's 4 control groups when you think about it like that. And you can't exceed 9.5% for any employee in that control group. So her explanation, and I'm going with it for now because I haven't read anything different, and I actually questioned it at the time, and was that, so say you have a minimum wage person making, minimum wage, and then you have some hourly minimum wage, and you have someone making $100 an hour that works for you, and they're both full-time employees, and they both are paid hourly, okay? Everyone in that control group in between those two can only pay 9.5% of the minimum wage earner's salary, okay? Does that make sense? So it's really low for the people at the top and 9.5% of the income for the people at the bottom. So it can be a different percentage of the income because you can't discriminate within that control group. Yes, ma'am?
What if you just go from vendor to vendor, like Blue Cross Blue Shield, et cetera?
Okay, so she said, what if you do not go to the health insurance exchange to receive coverage? So I'm guessing you mean that what if the employee who doesn't have affordable or doesn't have any coverage offered? Right, so it's unless they get a tax credit, okay? So this is really based on whether they are receiving a premium tax credit or cost sharing from the federal government. That's the determination, okay? Don't worry, we're going to get into it. Okay, everybody be patient. Is the employee eligible for a tax credit? Yes, ma'am.
Where you're losing me is 9.5% of a control group, but that control group doesn't reflect household income.
Right,
So,
right. I'm
Your lowest number becomes it for everybody.
and then adds to the spouse or the other household income.
right, but I'm advising you at this time, like we talked about here, to use what they make at your place of employment, because I'm not sure how they're going to make a determination of the household income. Yes.
And I think most townships have much less than 50 full-time people. So
Right.
none of that is going to apply to most townships. It's only going to be some very huge, maybe townships that, I can't even think of any
Right.
townships that have over 50 employees.
Okay.
So, it's going
Sure.
to be where we're saying, no, there's no penalty, and that we have to worry about if there's 25 people or less and our average is $50,000, then we might get a tax credit, which is
Sure.
what I'd be interested in.
Sure. I don't get there, I promise. So Donna said that most townships don't have 50 employees. So we'll calculate if you guys do or not here in a couple minutes. And then if you don't, we're going to talk about some tax credits as well.
I was just gonna ask about the FTEs.
Yep, full-time equivalent employees. We're going to talk about that. Okay, is the employee eligible for tax credits? So if your coverage is too costly through your employer, not offered through your employer, you may want to seek coverage on the exchange. If you seek coverage through the exchange, you may get a tax credit. And I kind of just wanted to give you guys an idea of 100 to 400% of the poverty level and what that is. So $46,000 for an individual, up to $94,000 for a family of 4. It's $126,360 for a family of 6. $126,000 for if you have 4 kids or 6 people, right? So those people are all eligible for some sort of tax credit at that Usually. They need to apply and submit their documentation and things. But if you make less than $16,000 for an individual, you may qualify for coverage under Medicaid. And we're going to talk about Medicaid in somewhat in depth here in a second. So it's important to understand whether an employee is receiving a tax credit, because this is the very distinction that determines whether the employer will pay a penalty. Okay, what are the plan levels? This is a general idea, although this is not how Blue Cross Blue Shield has them listed on their site. And since I can't get on healthcare.gov, I don't know. But here's what was a general understanding at the time from physicians what it was going to be. So the platinum is obviously the premium plan. You're gonna pay the highest premium with these plans, but the plan's also going to pay 90% to 100% of your coverage. Gold, 80%. Silver, you're down to 70%. A bronze plan, it's going to be your lowest premium, but I mean, it's gambling. You're going to take a risk because you're going to pay 60%. Your insurance company is going to pay 60%. You're going to pay 40% of the covered medical expenses. And then there's also, for individuals under 30 years of age, so that gap right there between 26 and 30, who have received the certification for lack of affordable coverage or financial hardship, you can seek catastrophic coverage, which is what we consider today major medical. Yes, sir?
Now, do all these plans have multiple deductibles available?
Yes. They're all over the place. Everywhere from that high range of $6,000 out-of-pocket expenses.
By out-of-pocket, do you mean deductible plus your 20% or 30%
Yes.
or 40%?
Yes.
So what, if the deductible a calendar year deductible or per accident or condition?
You're going to have to check the plans on that. I would guess calendar year. But I would get, from what I've read, it's every single one of them is set annually. So, but. Okay, small employer options. So this is a small business health options program called SHOP. You may have kind of heard it talked about somewhat frequently, and it's for employees with 1 to 50 employees, employers with 1 to 50 employees. After 2016, people with less than 100 employees, so it kind of closes a gap there. So larger employers are able to let their employees shop on the exchange. But this is a marketplace to obtain health coverage. From 2010 to 2013, here's what's happening. You have the possibility of taking advantage of the small business tax credit. Eligible small employers may be entitled to 35% tax credit for health insurance premiums paid, so what you paid. So the qualifications are that you have less than 25 full-time equivalent employees, and I promise you I'm going to show you how to calculate that. You pay 50% or more of their premiums, and you pay an average annual wage of less than $50,000 per full-time equivalent employee. If you have less than 10 full-time equivalent employees and annual average wages of $25,000 or less, you may have a full tax credit for your premiums paid. Now, the credit is a sliding scale or phases out between 10 and 25 employees, and the average wage from 25 to 50. So you guys may be in there somewhere. And then I gave you the IRS form that you can Google look up if you wanted it. It's 8941 on your federal tax return. Okay, and then tax-exempt entities can get up to a 25% tax credit. And then the tax form there is that 990T. So I put my little disclaimer at the bottom there that I'm not your tax advisor. But okay, 2014, employers may only be eligible for a tax credit if they purchase their company health insurance through SHOP. And the possible tax credit increases to 50% for small employers and 35% for tax-exempt entities. And then you'll see that $25,000 to $50,000 average annual wage amount will be indexed based on inflation, so it's going to change. It's not a stagnant number there that's never going to change. And then the tax credit's based on the lesser of the two. The lesser of the two being a specific employer's actual premium payment or the average premium payment in the small group market in that employee's rating area. So the lesser of the two is what they're going to base the tax credit on there. And then the credit is available for 2 consecutive tax years after 2013. Yes, sir.
We don't get tax credits, we're government.
Right. So Right, so, I couldn't hear the person in the back. Okay. Right, so some of these things, like I said when I started, are not going to apply to you because I'm going to talk about employees and how to make your determination, whether a tax exempt entity and whether you're going to get tax credit. But really, I'm trying to give you an understanding of the Affordable Care Act.
And I have another question.
Yes.
I want to go back, but I don't know, I want to backtrack. It
Okay.
has to do with the Cadillac plan, and the employees have to pay the $10,000 thing, and then the employer is then, if you exceed that, is going to have to pay a penalty.
Okay. I don't know what the Cadillac plan is. Are you talking?
There's
This?
a penalty if your annual coverage per employee exceeds $10,000. It was on your thing, under.
Okay. What page?
It's on there. If your individual employees receive a benefit greater than $10,000 per year, there's a penalty to the. One of my questions was, is that penalty to the employer or the employee? And the way you had it worded, it appeared that it was to the employer. And that's actually, and that constitutes a payment of around $900 a month.
What page?
Okay. If you can come up afterwards, I'll try to address it. I'm not sure where you're talking about. Okay, essential health benefits. So all the small group health plans and individual health plans are supposed to have what's termed as essential health benefits. And in determining that, the Illinois submitted an essential health benefit benchmark plan to the federal government, and they recommended what they thought the essential health benefits were. The general consensus is right here, an idea of what they are, but they are waiting on a determination and approval from the Secretary of Department of Health and Human Services, whether they have approval as to their submission. But once they do, then this is what should be covered in those plans that are offered on the exchange, and those plans offered outside the exchange, so that there's kind of a standard across the board as to what's being covered. And you can see that some of these things are somewhat new, and there may be supplemental coverage that's needed for like the pediatric care, including oral and vision. Some of these things like the preventative wellness and long-term type of things are really preventative medicine, like we talked about at the beginning. So things that they are hoping prevent future illnesses and things like that. So I just want to give you an idea of the 10 areas where they're saying that have to be covered within the insurance plans. So small employers have an option. There's 3 ways for Illinois to determine who selects the coverage. There's the employer selects the plan for the employee. They just go, this is what's offered, that's it. There's the hybrid plan where the employer selects a plan level. So we talked about like the platinum level or the bronze level, and they can select a level, and then the employee gets to go in there and pick which one within that level. Or they can just say, hey, this meets the shop plan design requirements, go out there on the shop and get whatever you want. So there's 3 ways to do that. So how do you calculate your full-time equivalent employees? First of all, it's based on hours of service. So you're going to determine all your hours of service, but you need to exclude certain individuals, okay? The excludable individuals are self-employed individuals, so if you own your own business or sole proprietor partner in a partnership. If you own 2% of an S Corp, individuals owning 5% of a regular corporation, and family members and dependents of those people. And then seasonal workers you don't add in your numbers. So if you have any seasonal workers that work less than 120 days a year, you do not add them in your hours. So then I wanted to give you an example so that this made sense. So I just picked random names here. And no one ever works more than 2,800 hours. So this is how many hours, 2080. This is how many hours they actually worked, and then this is how many hours are counted. So the first one's not counted because that's an owner or a proprietor, so you don't count them. The next guy works over the 2080, which is the threshold, so you only count 2080, same with Jan there. And then Katie is a part-time employee. I put her in here because I want you guys to realize that you count all your part-time employees' hours, okay? So you add all your part-time employees' hours in here, and basically, then you see you have 5460. You come down here, and your full-time equivalent employee is 5460 divided by 2080, which means you have 2.6. The rule is that you always round down unless it's less than 1, and you round up, okay?
That's unusual, because usually if it's like over 2.5, then you would round up, so.
Yeah, I know. It is weird. It is really weird to round down. I have to admit, when I calculated for several of my clients and was doing it, it felt weird to have a 2.8 or a 27.9 and go, okay, it's only 27. So, okay. Does that make sense, everybody? So here's what I want to make sure you understand. You can have a plethora of part-time employees, and you could actually have 50 full-time equivalent employees. Okay?
What is the break for the part-time, whether they're considered full-time or part-time, hour-wise? Is 1,300 the break mark, or you know what I'm saying?
Yeah, they originally did it, I think, at 120 hours a month, which doesn't calculate because they're using annual numbers here. But it was 120 hours a month. Yeah. Okay. Okay, so you are counted here for a determination as to whether, listen carefully, as to whether you have to offer coverage. So whether you're a large employer, you're counted here. However, when you get to determination of penalties, they're not counted for that purpose. You're part-timers. Okay? Yes, ma'am.
Why is Bob not counted?
Bob is not counted because he is an owner. Okay? So I put the excludable employees up there at the top. So it's a determination of hours of service of all non-excludable employees. You never count over 2080 hours, no matter if someone works while they're sleeping. They work all day, every day. It doesn't matter. You only put 2080 in there. You exclude, obviously, the excludable employees, and you do count part-time employees. Okay?
So are we required to offer the coverage to these part-time employees?
Yes.
Oh, so it's no longer 30 hours.
Right. So the other number that I want you to be really aware of in how to calculate is the average annual wages. And so I used Bob and Bill and Jan and Katie and Lee again so that you'd have a familiarity with it. But divide the aggregate amount of wages paid by the number of full-time equivalent employees. So you find that first number of your FTEs, and then you divide the wages by that number. So your average annual wages, so they were $67.50, and you don't count Bob because he's the owner, by 2, which was the rounded down number, which seems weird. And you round down again to 33,000. So you round down on this number too. So this is a determination of whether you're between that 25,000 and 50,000.
One more question.
Yes, ma'am.
Is an elected official considered an owner?
So I talked at length with, there's a 1-800 number that you can wait an hour to talk to somebody on. And I talked at length with them. They were very helpful. Their determination for elected officials was simply if you receive a W-2, you're an employee. That's what they were told to tell everyone. But that's why I've told you throughout this that you should seek tax advice as to whether or not. So if you get a 1099, you're not included in this number. If you get a W-2, you're included in this number. That was their sole advice on that question. Yes, sir.
Just wondering, when I think about this, when you think about townships and how we're broke up like governmental units, are they considering all governmental units as one unit for a township, or will that be individualized?
This is constantly, I think, a difficult question, and here's why. Because for many different applications. But for instance, the Open Meetings Act or Freedom of Information Act, and you're required to put things on your website, and you're not sure whether you're supposed to put it on for all the units of government or whether it's just your small unit of government. I don't have an answer. I'm sorry. I just don't know. Okay. I just don't know right now. And I know that's not the answer you want. I just don't know. So, and I think the difficult thing for you guys is counting the hours when your board members work. And if you guys pass around a piece of paper and kind of write down how many hours you work a month, if you don't do that, I highly suggest doing that. I have all my municipalities do that for a lot of reasons. But you should be tracking how many hours your trustees are working. So I don't know if you are doing that, but that's, otherwise, how are you supposed to calculate, So, yes, ma'am.
I may be wrong, but I think a simple answer to his question would be dependent upon the PIN number. If the town and the road district and the assessor's office all operate under one PIN number, then they're going to be treated as one employer.
Right, so do you know? Okay. So obviously they're not going to apply multiple credits to one VIN number, so that would make sense. Or no credits in this case. Okay. So how does this affect Medicare and Medicaid? And like I said, some of these things aren't necessarily just township specific. I really am here to give you an overview of what it's doing. So Medicare Part B reimbursements, or the physician fees that are paid through Medicare Part B, are still linked to this formula that's back from the 90s. It simply does not cover the costs of providing services to consumers and patients. So this is a problem that's continuing. Congress has annually passed short-term solutions for reimbursements in the past, but it's possible at some point they just say we're not going to do that anymore, and then the reimbursements are going to go down by 25%. I will tell you that the last time I talked to a physician about this, they informed me that their reimbursement rates right now were 17% of what a cash pay was. So if that puts it in perspective. Okay, and then initially the Affordable Care Act mandatorily expanded Medicaid. However, this is where the United States Supreme Court found this unconstitutional, and so the Medicaid expansion was left as an option for the states to opt in. Illinois was one of those states that opted in. 25 have chosen not to opt in. Illinois did opt in, so beginning October 1, coverage hopefully has started being offered, which will begin January 1, 2014. There has been some talk that it's going to cover some backdated bills from the end of 2013. The expanded coverage to consumers is up to 138% of the federal poverty level. So that's approximately $15,860 for individuals and $21,400 for couples. The federal government initially is going to pay 100%, but then in the future it's going to dwindle down to about 90%. I will tell you that some of these new enrollees were previously eligible. They just didn't seek out the coverage. And for those people that would have previously been eligible for Medicaid, the federal government's only going to pay 50%. Illinois pays the other 50%. And then the costs are estimated at approximately $2.3 billion for the previously eligible individuals that are new enrollees. So they could have gotten Medicaid before, they just didn't go sign up for it or didn't know about it. The cost is about $2.3 billion for 2014 to 2020. Yes, ma'am.
When the feds stop funding the bulk of this, can Illinois go back and opt out?
I'm not sure what the opt-in, opt-out is. Now, they are in now deep, but I don't know whether they can later go back in and opt out, because now they've provided coverage to all these people that are just otherwise now going to go back on the exchange and seek coverage. The same people are still going to need coverage. So.
Right, but when it gets to the point where Illinois has to foot the bill more
Right,
than
I
the
see.
feds,
Mm-hmm.
they can't afford it, are we going to see across the state cancellation like they did to AMI?
I don't know. So I'm not sure whether when it goes from the 100% to the 90%, whether they'll do that. So the expansion is going to provide Medicaid coverage to about a third of all Illinoisans. It'll cost about $12 billion from the federal government through 2020, and it costs Illinois $573 million. So a drop in the bucket for us is $573 million compared to the $12 billion the feds are going to pay. But the goal is going to be to provide consumers with timely and regular medical care, and really the focus here was on primary care physicians, office visits rather than ER visits. We all have a good understanding that a lot of people go to the emergency room that could have sought the appropriate care at a primary care physician's office. So some of the other results are going to be that charity care at hospitals is going to be reduced because these people are going to have coverage through Medicaid. However, when they lose their charity care and some of the other impacts of Affordable Care Act, there's a possibility that some of these tax-exempt hospitals are going to lose their status. Yes, sir.
How it will affect GA, general assistance outpayments for catastrophic medical care to GA participants. Is there a thought that since everybody's going to be covered, the townships won't be burdened with this under their GA fund?
There's a hope that, honestly, there's a whole plethora of groups that they've identified that they hope will lessen having to pay for medical expenses from these people being insured. I'm not so sure that's going to be the exact result, is that the GA funds will be affected. But
No, also in that line, the, our GA, you know, my people get $245 a month, so if they're gone for 12, months, then they're getting like 29, under $3,000. So that's definitely going to put them in a low income range.
Sure.
But from what I'm seeing, will put them into the Medicaid area. Is that your understanding of that?
Mm-hmm.
So then, if they're in the Medicaid area, then they're going to have the same coverage as Medicaid, but there are still, in Medicaid, aren't there co-payments and all kinds of other things? And then that's what the GA is going to be responsible, as we are responsible for covering medical for?
Right, and so the co-payments are small. The co-payments for a physician visit are $2.90, and then the prescription costs are somewhere between $2 and $3.90. But I'm not so sure that that's what your funds are going to cover. You see what I mean? And so, okay, so let me just explain a couple more things, and I won't leave this slide, I promise. There's still going to be a problem with providing coverage through Medicaid for several reasons. The first reason being that physicians are still going to deny access. They aren't going to just start taking a ton of Medicaid patients. We are the 41st state in regards to reimbursement rates. There's only 9 states lower than us regarding how our rates for reimbursement for physician visits and things through Medicaid. And also, I don't know if you guys knew that Medicaid patients are only allowed to get 4 prescriptions per month. So someone with a chronic illness, you could obviously see that this creates a huge problem because they need well more than 4 prescriptions per month. Yes?
The statistic now is 1 in every 3 people are going to be on Medicaid.
Yep.
What is the current percentage? Is that given anywhere?
I don't think I think I have the combined percentage that I said at the beginning, but it's with Medicare and Medicaid, and the combined percentage was 32%. So that's Medicare, Medicaid, any other state-funded programs. So, and actually, I think the number, now that you say that, is 20%. So the current number is 20%. Okay. So the expansion we talked about is going to be up to maybe a third of all Illinoisans. That's just their estimates right now. We obviously don't have numbers. And they estimate that there's going to be more than 1 million people with Medicaid or health exchange coverage. The payments are not expected to really change. They're going to be low and slow like they always have been. That's been a constant gripe from the beginning. Approximately, so I wanted to give you numbers because I feel like this helps. Approximately 296,500 will be added in 2014. As of November 7th, 44,000 applications had been filed for Medicaid, in addition to another 100,000 from the Cook County area. They had an early enrollment program that they ran, so they had another 100,000, so 144,000 so far. There's also the possibility that another 46,000 are going to be express enrolled simply by currently receiving food stamps. So they take that criteria and say that it's sufficient, so those 46,000 are just in. And so by 2017, we're going to expect about 500,000 more enrollees. So that puts it in perspective a little bit. Yes, ma'am.
Relevant to the person who asked questions as to how this would impact general assistance, this has nothing to do with general assistance. General assistance is a financial program, and if your client has no income, then they need to apply for county care, which will turn out to be the public aid program. And eventually, all of your medical will disappear because it will be taken up by Medicaid. And as for the negative points of only having 4 prescriptions a month, there are a lot of programs out there that will offer you prescription assistance, in which the manufacturer is willing to help a lower income individual with their prescriptions. And in some cases, and I don't know the percentage, but I think that it's very questionable, there's a lot of doctors that are overprescribing, and they're not looking at all the diagnoses of their clients. Many of your clients, if you question the doctors closer, really don't need more than 4 prescriptions a month. So that's in a nutshell.
Okay.
If they don't have time now and they're overprescribing, if they're doubling and we're having this doctor shortage, how are they going to be able to analyze better if they're overprescribing in the future?
You know what? If I have that many, if I have a client that has so many prescriptions, I will call the doctor because I won't pay for the extra prescriptions. I want to know what is the diagnosis and why this medication is being prescribed.
Are you saying you limit?
No, I'm not.
Okay, so we're going to move on because everybody's an expert on this area. Okay, so October 1st, Illinois launched, it was supposed to launch the ABE website. And so, and like I said before, I am not trying to be rude. I'm not on either side of this. I'm trying to give you a basic overview so you can take it back to your constituents in your township and have a general understanding of what's going on. Some of these things are not determined yet. The final rules aren't even out. There's tons of provisions that aren't even enacted yet. So, okay. The Illinois is starting a website called the Application for Benefits Eligibility. And on this website, you can apply for Medicaid, SNAP, cash assistance, and you can submit electronic signatures and download and upload documents, but it's called ABE. So I wanted you guys to be aware of that. I didn't put it on my slide, so you may want to jot it down. Application for Benefits Eligibility, ABE. And that's an Illinois-based website, okay?
Say that again, the whole web.
Applications for benefits eligibility.
And what's the website?
You can get it from the Illinois.gov webpage. Illinois has actually a fantastic overview of what the Affordable Care Act is, and it's called Healthcare Reform. And so on my last page, I have all the websites for you. Okay. Okay. Frequently asked questions. Are you required to provide health benefits to your workers? No. However, large employers face penalties for not making affordable health care coverage available to their workers. Penalties start in 2015. Do you have to provide affordable coverage to the families? No. We talked about the fact that it's individual coverage based on that 9.5%. What will happen with Medicare and Medicaid, which we talked about, seniors will have similar coverage with better prescription drug coverage and better preventative care coverage, and then Medicaid expanded to cover more poor adults. In the states, I wanted to make sure you guys understood that the states decided this aspect of it. It wasn't a federal decision. And then what is the health insurance marketplace? I gave a basic overview. It's a state-based marketplace, allows employers and individuals to compare insurance plans. and you can select how much coverage you want, or what you, obviously not what you want to pay. You can't put a dollar in. Yes, sir.
Just so we're clear, that the figuring out of the FTEs to determine whether you are 50 or not 50.
Right.
Does that affect at all the current policies as to whether you offer insurance to people? I mean, just because you're counting part-time employees towards the FTE, does that mean that you have to, if you offer a plan, you have to offer that plan to part-time employees?
Let me put it this way. So when you're counting your employees and you figure out, oh my gosh, I have 30 full-time employees, I have all these part-timers, and it puts me over 50 full-time equivalent FTEs, when it puts me over that threshold, and I only offer to the full-time employees, your penalties are based upon full-time employees, not part-time employees.
Okay, but if you have 10
So,
employees, you have 10 employees.
Okay.
And our policy is that you have to work 24 hours a week to be eligible for health insurance.
Uh-huh.
I don't have to give
Right.
them insurance.
Right.
Okay,
Right.
thank you.
Does that make sense? You're not penalized for the part-timers, which kind of is an implication that, yeah, okay.
But let's say you're below the 50, and so you don't have to do, you're not going to have any penalties.
Right.
But if you do offer insurance, are there any rules that this, or do you just tell your people that you don't cover, say, go to the exchanges and see what you can do?
That's right.
Right, right. I'm not aware of anything that would require you to offer it to them. Okay. What will happen to Medicare and Medicaid? We talked about what's the health insurance marketplace. The plans will be a comprehensive set of services. Everyone has to be offered insurance regardless of health, with those exceptions, and not allowed to charge for more pre-existing conditions. Do you have to pay penalties for part-time employees? No. Although part-time employees are included in the calculation as to whether you're a large employer, the employer does not have to pay penalties for part-time employees that receive subsidies as a result of coverage through the exchange. So even though they went to the exchange and got coverage, you don't have to pay penalties on them, okay? Open enrollment, October 1, so it's already in effect right now. You're in it till March 31st, 2014. And then coverage begins January 1, 2014. Who's a full-time employee? Right there you have your 30 hours or 130 hours in a calendar month. So I said 120 hours, 130 hours in a calendar month. And then who is an employee? Like I said before, I asked this exact question of the federal government, and this is what they told me. So anyone receiving a W-2 form, what time frame do you use to determine if you're a large employer? It's based on the preceding calendar year. However, this year alone, it can be based on 6 months, so instead of a whole year before. If I already have coverage through an employer, will it change? This is a question that is very controversial. It depends. You should be able to keep your coverage without change. However, insurance carriers have removed certain policies from their menu rather than phasing them out. This is, and I wanted to make it very clear here, this was a business decision from the insurance carrier's perspective. They have to submit substantial paperwork to each state based on the policies they're going to cover. And I think everybody from the beginning knew, all the policy advisors knew, and it's been talk from the day this was passed, that insurance companies simply are not going to try to continue to have these old plans. They're going to have all their plans comply with ACA. With the essential health benefits and things, and they're not going to phase them out. So a lot of people have had their coverage canceled as a result. Now that wasn't ACA coming in and saying, hey, that policy has to comply. It was simply a business decision from the insurance companies that was, look, we're not submitting this policy anymore. It doesn't comply. We're going to keep all the policies, aligned. So a lot of people have lost coverage because of that. But how do you count part-time employees? Calculating FTEs. All employees who are not full-time have to be counted in the aggregate and then divided by 120. So I hope that's helpful. Then the last page is your resources. And there's a 24-hour help hotline. They do answer. They do talk to you and give you answers. The shop hotline, so this is where a lot of you would be a quicker response probably. Is that 1-800 number, although I don't believe it's 24 hours. And then you'll see that this is the federal government. This is the Illinois. This is the Kaiser Foundation, which is a really helpful website if you want to learn, even more than we talked about today. And then obviously tax advice here. And then this was the resources I was kind of telling you about with the fact sheets and general knowledge. So that is all I have for you today. If you have questions, you can ask them now, or you guys can come up individually if you have a specific question.
I just want to clarify, you
Yes.
didn't say 120 hours for part-timers?
It's 1:30.
And it is 1:30?
Yeah.
Okay.